The Nigerian government says 745 persons have died and there are 8,000 suspected cases in the outbreak of cerebrospinal meningitis.
Indeed, the Nigerian Center for Disease Control says 95% of the cases have reached outbreak levels for CSM serotype C. The worst states are Zamfara, Sokoto, Katsina, Kebbi and Niger. Occupational Health and Safety Managers Ehi Iden joins us now to tell us more about this. Good to have you with us.
So good being here.
Now, is an epidemic imminent at this rate?
Well, we are at this point with the figures that we see being read out. This we can actually call an epidemic. Nigeria is actually at the verge of having what you call medical emergency disaster. We just have to see what we can do. And I was reading the recent report yesterday, and I really got worried because schools are resuming. And we know meningitis is contagious. Children went on holidays during the Easter break. We don't know where each child went to, but they are coming to converge in same classrooms. You have some children who went for holidays in the meningitis belt or prevalent region, and now they are coming back to schools. I've been waiting to hear what government has to say about this, but up to this moment, we have not heard a word. It won't be in anybody's best interest to see the school opens where we allow this disease to go out of control.
All right, but the federal government, we understand, has waded into this and also ordered for vaccines, about 800 doses to contain the spread of this epidemic. But isn't that enough, or what other measures should be applied now to control this epidemic from getting out of control?
As at the last week when I had interview here, we heard the governor of Zamfara State lamenting that he wants about 3 million doses of this vaccine. All that got to him was 300,000. We're looking at just 10% out of what he really needs. We don't have enough of the vaccines. What's going on, we don't know. Perhaps we have them, they are not reaching those who really need the vaccine. When you look at medical triage, look at those who are the highest risk. Those are the people that should have this vaccine at this time. Yeah, we bring the vaccine to the country. Countries that really do not have immediate outbreak should relax a little to give room for those where we have prevalence of these vaccines to actually get vaccinated, and that's the issue. So there are vaccines, but where are they?
All right, let's talk about some specifics here. It is said that this is type C meningitis, and this is the first time we have this strain in Nigeria. Now, is this a major challenge to health authorities in this regard?
I would say yes to type C, because what we've had before now really was type A, but it's the first time we're having type C. Obviously, the level of preparedness that we expected wasn't there because it was not expected. Though we have the A or this Y, but type C just surfacing in the country for now. So we're battling to actually get vaccines to actually manage them because it's not what we expected. We were ready for the type A that we're used to. This just came up. That's why I found out that when it came up the first time, we didn't have vaccines for this infection. People started giving the one for A and for C, and it's a big problem. But I think I just hope we're able to learn from this, because this is not going to be the last time. And going forward, when it happens, at least let's know, yes, even though we don't have this type of meningitis or disease in this country, and there are types, series of types, but let's try as much as possible. If we have about 20% preparedness for diseases that are to happen, we will just manage this thing better than we are doing right now.
All right, pending a solution to this epidemic, what preventive measures can one adopt now to forestall or prevent this from escalating or spreading in our own environment?
Just like what we did when we had the Ebola incident with us. The best form of prevention we can actually have right now, please let us go back to the culture of hand washing with soap, maintain good hygiene like we did in Ebola time. We're going to actually see how we can do away with overcrowded environment, like children living in dormitory and what have you. We have to see how we can actually limit that to a very considerable limit. Sharing of utensils, we should do it from that for now. Not because we're not saying we don't love ourselves, that's why we don't share utensils. People share toothbrushes. We have to actually watch out for those. There are things that we know that can actually cause intermix of droplets. We have to actually make do with those for now.
All right, Ehi Iden, we'll leave it at that. Occupational Health and Safety Managers would like to thank you for your time.
My very pleasure.